We're Justice Through Music at the Unity Conference for Medical Cannabis 2014. We're here at TJ, and we're here to go over a story about your vet. You served in what service? What branch?
U.S. Navy.
U.S. Navy. All right. And tell me about how you came about to medical marijuana. And, even going back to, you may have used it recreationally in the past. And so tell me how you came about, how you use it and what you use it for.
Well, I have post-traumatic stress. I was going to the VA hospital for treatment, and they actually diagnosed me bipolar, but that was kind of a misdiagnosis. I've been seeing a therapist outside that I see every couple weeks, and he's like, there's nothing bipolar about you. But the VA has been doing that, diagnosing people with bipolar to get away from that post-traumatic stress necessity stuff that they have to do if they diagnose you with that. So I was taking the meds that the VA hospital had been giving me for treatment, and Ativan was one of them, anti-anxiety pill, and I actually overdosed on it. And I said that I'm never going to take anything that alters my mind like that again, when my previous use of cannabis had actually, done exactly what the Ativan was doing, but without the adverse side effects. So I decided to not take those anti-psychotic, anti-seizure type, anti-anxiety type drugs anymore.
So did you always have a little bit of recreational marijuana around you? You knew a friend that had some, and you said, I'm going to buy some?
Yeah, well, I worked in the restaurant industry, and the restaurant industry, a lot of people smoke cannabis, so I was able to get access to basically, some very high quality medicinal grade cannabis.
But you still had to buy it illegally.
Right, and I do. That's one of my speeches when I'm talking to people is, I'm a veteran, I'm a parent, I'm a U.S. citizen, but I have to break the law every day in order to make myself a functional veteran, a functional parent, a functional citizen. And if breaking the law is what makes it happen, then I'm going to break the law until the law is changed while I'm fighting to change that law.
There's a lot of talk about freedoms these days and liberty and stuff. Tell me how you feel about you not having the freedom and liberty to get the medicine you need.
Well, first and foremost, we're looking at veterans not being able to discuss medical cannabis access with their VA doctors as a violation of freedom of speech. They are
So explain that to the public. Does that mean that they might get a dishonorable discharge, lose some benefits?
Oh, well, no. You're already outside of the military. You're already diagnosed with conditions that have been proven to, be treatable with medical cannabis, and so why not allow access? Why not allow the VA doctors who are supposed to be providing 100% of care to a lot of veterans that go through the VA hospital? Why not allow them to fully treat with medicine that we know works for the conditions that we face as veterans?
So, for you, you might be sitting there, you might be getting a panic attack, feel a little anxiety. To describe, how it feels. Do you smoke, or how do you ingest your?
In a panic attack situation, ingesting through the lungs is probably the quickest, best method to kind of stave off a panic attack, which that's what I have to worry about a lot of. And so I smoke because that's what's accessible in a prohibitionist state like Virginia. I like edibles because I don't personally like smoking. I gave up smoking tobacco products back in 2009. And so every once in a while, I understand that it is the quickest method of delivery into the body. So edible products are amazing. There's elixirs, there's tinctures for sore limbs. So again, it's a medicine that helps a lot of issues that the veteran community faces, and it could alleviate a lot of prescription drug abuse. It could alleviate the amount of money spent on certain prescription drugs. I have friends that have said they've been able to go off a lot of just basic anti-inflammatory drugs that do extreme liver and kidney damage. They're able to half the dosage, if not completely remove it, because the anti-inflammatory properties that safe legal access to medical cannabis provides for them.
Do you find that indica helps you better than a sativa because you're looking to relax yourself?
Yes, I do prefer indica dominant strains. However, I also use cannabis to function throughout daily life. So sometimes if I'm not worked up, a sativa is actually good for me because it's kind of like a cup of coffee, but it still has those effects mentally that help clear my mind and keep me functioning and, alleviate that hyper alertness.
So you live in Virginia. Have you ever pondered maybe being a medical refugee and moved to another state?
No, because in Virginia we just had our first lobby day back in January as a group, and it looks like we're going to have some pretty friendly legislation introduced in the 2015 session of the General Assembly in Virginia, and it's looking like I would never have to consider that. And again, I would fight for my right as well as every other patient's right regardless for safe legal access.
Virginia just elected, for the first time in 60 years, a Democratic governor, lieutenant governor, and attorney general. The state house is still held by the Republicans?
The state house is still held by the Republicans. However, during our lobby day, we were actually fighting a bill that was introduced to repeal the extant law in Virginia, which says marijuana is legal for cancer and glaucoma patients, but it uses the term prescription, and pharmacies are supposed to dispense it. So there was a delegate that was actually trying to just get rid of that law completely and make marijuana completely illegal in the Commonwealth. Well, we went up there and fought against that bill, and then we actually made some new allies, and Republicans who control the House are willing to stand up for us, their constituents, just normal average Virginia citizens. So they're going to stand up for us because we spoke out, let them know that we're patients. We're just looking for something that helps us. And so we think we're going into 2015 with some really great momentum in Virginia.
Great. So you think there might be possibility of getting a bill on the floor in Virginia, or at least in the committee?
Yes. I have a feeling the lieutenant governor is actually going to work on legislation in the Senate, and so we know it's going to go through the Senate. And then, like in the House, one of the biggest fights had been in Virginia that it was a criminal issue. It wasn't a health care issue because the way the code was written, it's in the criminal code versus health care issues and laws. So we've actually got the criminal committee to realize that it's a patient health care issue, and they're going to help us make sure that it gets heard before the proper committee.
Look on that. Are you going to be doing the lobbying on Monday, tomorrow?
Yes, I will be.
So you're going to your federal representative and senator?
Yes. Senators Mark Warner and Tim Kaine, and Congressman Randy Forbes, ranking Republican in the House. He's kind of come across as, not a supporter, not against it to me. I don't see a lot coming from him. Both Senators Warner and Kaine, both very great Democrat leaders of the Commonwealth as former governors, and from some stuff I've seen, Mark Warner might have some higher aspirations come 2016. So I hope that they stick their necks out, because a lot of times Democrats do step up for patients and health care. So I would like to see Senators Warner and Kaine stand up for Virginians. 84% of Virginians, according to the most recent Quinnipiac poll that came out last week, support medical cannabis. So if 84% support, then on the federal level, they should take that 84% of Virginians and vote yes for any medical cannabis in the Senate.
Lastly, then, I'd like to get your thoughts. They just finally approved a study to study the effects of using medical cannabis on PTSD, which is actually, I hate to say it, I'm going to be a little bit ignorant on the subject. I think it's a third party that's doing it, or the NIH, can't remember. Give us your thoughts on that. What do you think they might encounter? What you hope to come out of that?
Well, yeah, it's a MAP study through the University of Arizona, and basically it's studying the effects of vaporized cannabis. I think it's with like hard to treat post-traumatic stress. I think I haven't read the complete details, but it's been held up for I think like 3 or 4 years. Getting approval. One federal agency will approve it, then another one will reject it, then it comes back through. The one that just approved it will reject it. So it's been going through this cycle.
Vegetarian's nightmare.
Right. So what we hope it accomplishes is it proves, that what a lot of other country studies are proving, that post-traumatic stress is treatable with medical cannabis, and inhalation is probably one of the best forms of administration, especially when you're trying to mitigate the panic attacks. When you're trying to mitigate the suicidal ideologies. So
you think real quick? I'd like to hit you on that because right now the focus last year was getting the disability list whittled down. They're going to continue that. Project 22 has started, where we know average of 22 veterans commit suicide every year in this country, which is horrible. We want to really focus on this here. So you think medical cannabis probably has exciting opportunities to help us with that problem, don't you think?
Well, here's what I have to say about that. Study released last year by the federal government on whether medical cannabis mitigates suicide rates said 10 to 12% was where the numbers fell. And I use that number in the category of 18 to 34-year-old males, which would be your target category of post 9/11 veterans. I myself am 34, and I served from 98 to 04, so I'm kind of at the older end of it, excuse me. But that rate decreases, and the number that I came up with was around 8,000 veteran lives a year, just comparing numbers. Could be saved if we legalize medical cannabis for veterans.
I'm sorry, I had one last comment. Chuck Hagel, our defense secretary, mentioned the fact of taking cigarettes off the shelves in the PX and commissary on bases, and has gotten massive attack about attacking freedoms that soldiers should be able, the freedom to buy a cigarette. Yet, you have thought on that real quick in a minute, and don't you think if they want freedom, people should pushing for the freedom of the soldiers to buy a cigarette of the PX, shouldn't they be able to go to the VA hospital, the military hospital, and have the freedom to have medical cannabis?
Yes, I mean, I stay neutral on the cigarette topic, especially being from a state like Virginia that was founded this nation on tobacco. But I lean. A lot of my friends get mad at me because they say you care about healthcare, but you don't take a stance on cigarettes. But I do believe it is a freedom. I always use the saying, hey, if it's two people of legal consent, then let them do what they want as long as they don't interfere with the rights of others. But it could be portrayed as an issue of freedom, because it is something that's legal in this country, and therefore, if anybody should have access to it, it should be our veterans, it should be our people that are active duty.
And then, but also at the same time, then you should have also the freedom to get your medical cannabis.
The freedom to get your medical cannabis. When there are studies out there that state, cannabis introduced within so many hours of exposure to trauma actually causes the trauma to go away, and then mitigating the effects of post-traumatic stress, helping with cancer, with increased Agent Orange through the Vietnam vets, increased cancer rates. Well, let's see what cannabis can do for them. Let's study that. Why stop at post-traumatic stress when veterans face a plethora of issues that all Americans and all humans face? Let's go on ahead, and veterans are willing to lead the fight. So
excellent. Well, thank you. Good luck next year. You're going to need it.